Maori health providers have reduced the vaccination gap to 10% behind the general population, but experts say it's still too soon to celebrate.
The sluggish start to the vaccine drive and staff fatigue on the front line are now impacting the booster rollout for Maori. And there are calls to reduce the gap between the second dose and the booster. Maori Affairs correspondent Terina Kowhai has more.
Working in overdrive and Maori health workers putting in overtime.
So today we've extended services from 6 a.m. to 6:30 p.m. for our working populations out here. And we've got 4 mobiles out on the street now in different areas taking services out to our people.
105,000 Maori have been vaccinated since November, but the workload is taking its toll on vaccination staff.
I think I can say on behalf of all of us, we are feeling tired, but we're ready.
Data analyst Dr. Aori Taunui says Maori are still playing catch-up and wants to see the wait times between doses shortened.
Those people won't become eligible for a booster shot until the 1st of March, and that's way too late. Omicron's going to have a 6-week head start on them.
Reducing the interval between the second vaccine and the booster is being used in some states of Australia and Britain. Now Māori health experts are calling for the government to do the same for Māori to get them better protected as soon as possible.
During Delta, Māori were 50% or 13 of 26 deaths. And if we get a number of deaths with Omicron, there's a high likelihood that the majority of those are going to be Māori.
Meanwhile, immunisations for tamariki are slow off the mark. Māori 5 to 11-year-old rates are around 50% behind the national average. Waipareta Trust boss John Tamihere isn't ruling out taking the Ministry of Health back to High Court a second time to release vaccination data for children too.
We're running into the same resistance from Mr Bloomfield and co again over our children's data. So it's just unfair what they're doing. It's bizarre. If we can get the parents' data, you'd think we'd be able to get the children's.
The Ministry of Health says it will consult with iwi leaders and Māori service providers before releasing what it considers sensitive information about children. Meanwhile, the ministry says it will stick to a 4-month gap between the second vaccine shots and boosters, but will listen to advice from health experts. Terina Kowhai, News Hub.